I'm Chandra Price with the Medicare Teachers Agency, and this is my dog Max. We are not part of the federal government. We don't work for the government. We are not endorsed by the government. We are an independent brokerage, and we are in many states across the country trying to help people with their Medicare. Max got a haircut recently. What do you think? Today, we're going to talk a little bit about financial assistance programs, specifically the Medicare Savings Program and Extra Help. So the Medicare Savings Program is for people who have very low income and very few assets. And the Medicare Savings Program is going to help people who have Medicare pay for their Part B premium and or their costs when they go to the doctor. So this is when people talk about this program, oftentimes people say Medicaid, but technically it's the Medicare Savings Program, and there's different kinds of programs within the Medicare Savings Program. QMB and QMB Plus. QMB stands for Qualified Medicare Beneficiary. And if somebody qualifies for QMB, then they're going to have their Part B, as in boy, premiums paid for, and then their cost sharing also paid for. When I say cost sharing, I mean deductibles, co-pays, co-insurance. That's going to be picked up by the state that the person resides in, because the Medicare Savings Program is a state-based program. So when you apply for QMB, you're going to apply through your state. So you'll apply through your local Health and Human Services. And typically you can go into your county's Health and Human Services, depending on your state. Maybe not every county has their own local office. So you'll want to talk to your broker about how you can go in to apply for a Medicare Savings Program. The next level down is SLMB, SLMB. And SLMB stands for Specified Low-Income Medicare Beneficiary. If I didn't say what QMB stands for, it's Qualified Medicare Beneficiary, but you typically just say QMB. SLMB is Specified Low-Income Medicare Beneficiary, and there can also be SLMB Plus. And SLMB typically just pays for the Part B premium each month. So the state of residence is going to pay that person's Part B premium for the federal Medicare program. SLMB Plus, not every state has that available, but then if somebody has SLMB Plus, it's probably going to pick up the cost sharing for medical services as well. There's also QI, qualifying individuals. There's QDWI, qualified disabled working individuals. And then there's FBDE, full benefit dual eligible. And these are all different kinds of programs that people can enroll in through their state to get assistance with the costs associated with Medicare. Now, if somebody qualifies for the Medicare Savings Program, then they're considered dual eligible, meaning that they have Medicare and also Medicaid. But not all dual eligible recipients, Medicare and Medicaid recipients, are going to qualify for the same plans. So you want to make sure, if you think you might qualify, to talk to your broker about what plans are available to you in your area. Now, there's also a federal program to help with costs associated with the prescriptions when people have Medicare, and that's called Extra Help. It's a federal program called Extra Help. Sometimes you'll see it written as LIS, which stands for the Low Income Subsidy, but most of the time when people are talking about it, they're going to say Extra Help. And if somebody has Extra Help, they're going to have extra help with their Part D prescription costs, whether that means with a deductible, if a particular plan has a deductible. If somebody has extra help, they can qualify to have the premiums that they must pay each month for their Part D prescriptions reduced, sometimes down to zero. Sometimes with other plans, the cost can get reduced as well. And I'm not going to go into that because I don't want to get in trouble by saying things I'm not allowed to say, because there's so many compliance rules. But that's what Extra Help does. It helps with the costs associated with prescription drugs. And then when people go pick up their prescriptions from the pharmacy, If you have extra help, your costs are reduced, sometimes all the way down to zero because of the federal extra help program. So if you want to apply for extra help, you can go into your local Social Security office. You can also apply at ssa.gov. That's the Social Security website. And when you're going into Social Security or Medicare, double check that the website you're going to has the extension .gov and not .com, because you could end up on the wrong website, and you don't want to put your information into a website that's not the government website that you're intending to go to share your personal information. So extra help is for Part D prescription drugs. The Medicare Savings Program is for the costs that are associated, they're left behind by your original Medicare or by a Medicare plan. And if you have questions about any of that, please give our office a call at 1-866-READY65. Visit our website, medicare-teachers.com. Thank you.